Are you feeling sad and alone? Or do you feel tired and fatigued with no real reason why? Does it just feel like the world is just flowing around you? Or is the hustle and bustle of the city just keeping you down, where you just feel depressed? Or are you a depressed nursing student that drops her books when walking into school? If this is you, you might have depression, or you may have anxiety as well. One of the first things about anxiety is that there's a lot of treatments available, one of which is SSRIs, or selective serotonin reuptake inhibitors. But depression and anxiety can come in many forms, such as acute depression, acute panic disorder, acute depressive disorders, bipolar I disorder, or moderate to severe bulimia nervosa, PTSD, and other major social anxiety disorders. If you feel sad and depressed, call your doctor and ask him about Prozac.
Prozac is a selective serotonin reuptake inhibitor that is taken once daily as a pill. Take the lowest recommended dose in the morning to avoid insomnia. Do not stop suddenly and monitor for signs of toxicity. It's normal to experience any of the following side effects. However, call your doctor if they are persistent or become intolerable: nausea, drowsiness, dizziness, anxiety, loss of appetite, sweating, sexual dysfunction, rash, or grinding of teeth.
When taking this drug, please monitor your blood sugar levels, as this drug could lead to hypoglycemia. Please also have family members and/or friends watch closely for any suicidal ideations or tendencies. This effect is most prevalent in young adults and teenagers. Avoid any driving or mental activities while this drug is in effect. Do not abruptly stop taking fluoxetine, as it could cause severe adverse effects. Considerations: please do not take this drug if you are pregnant and breastfeeding or have any hospital complications. Please do not take this drug if you have a hypersensitivity to fluoxetine or other SSRIs. Talk to your doctor before taking fluoxetine if you have liver, kidney, or cardiac disease, any seizure disorders, diabetes, ulcers, or have a history of bleeding.
There are many drug interactions that you should be careful with. Alprazolam and diazepam causes half-life of fluoxetine to increase. Anticonvulsants increase toxicity. Aspirin, NSAIDs, and warfarin increase risk of bleeding. CNS depressants increase risk adverse reactions to the drug. TCA, MAOI, and St. John worts increase risk of serotonin syndrome. Fluoxetine increases blood levels of lithium and TCAs. Warfarin blood levels can increase with concurrent use.
Call your doctor right away if you experience seizures or thoughts of suicide. Notify your provider with signs of low blood sodium or hypotension, such as dizziness, lightheadedness, fainting, nausea, blurred vision, or cold, clammy skin. While rare, a serious condition called serotonin syndrome can occur, so call your doctor if you are experiencing restlessness, confusion, fast heartbeats, sweating, or trouble with muscle coordination. Heart arrhythmias have been reported while taking fluoxetine. Notify your doctor if you develop any changes in heart rate, palpitations, shortness of breath, anxiety, or fatigue. Fluoxetine can increase your risk for bleeding. Signs of this include black tarry stools, blood in urine, excessive bleeding from your gum.
Now then, let's decide. Maybe there's a happy tree, evergreen tree. He lives right there. Start with just touching the canvas. Use just the corner of the brush, just the corner, and begin pushing, making the bristles bend slightly downward. See there? Look at that. Isn't that a nice little tree? And he lives right here in this brush.